Okay, we are back to doing business here in the Health, Finance, and Policy Committee. Welcome, Representative Marquart. You have House File 1016. And since you're not on the committee, the chair will move that House File 1016 be laid over for possible inclusion in our finance bill. Welcome, Representative Marquart. If you'd like to explain your bill.
Well, thank you very much, Madam Chair and members, and I appreciate you not only hearing the bill, but also accommodating my time. I set up weeks ago to read in a second grade classrooms here at Dilworth, Glen, and Felton. So I was reading today Woodrow the Mouse running for president. So that was what I read. So anyway, thank you so much for accommodating my time. So House File 1016 is a bill that was brought forth by a constituent, and it regards the license recognition for nurses from border cities, for border states, reciprocity. And the case is that it's a nurse who's licensed in North Dakota, treats, provides services, does procedures for a resident of Minnesota. And what this would allow is that in an aftercare, or later on, if this nurse in North Dakota was to inquire about how this patient from Minnesota was doing, they would be able to do that as long as it was limited to a telephone conversation or like a Zoom meeting or something like that. So that's basically the extent of the bill. And so, members, I would be open for questions.
All right. Well, thank you very much, Representative Marquart. Appreciate that. I see that we do have a question. Representative Boldon.
Thank you, Madam Chair, and thank you, Rep. Marquart, for bringing this forward. My question is, would the reciprocity go both ways? So in your example, it was a nurse from North Dakota, I think, caring for a patient in Minnesota. My question is, would this also cover nurses in Minnesota? Because I'm hearing that this is happening as we are having, more telehealth, or even, patients seen here in Minnesota. They may be seen here in the hospital, discharged to home. Would the nurse in Minnesota be able to have follow-up with that patient in North Dakota, under this bill? Thank you.
Representative Marquart.
Yeah, Madam Chair, Representative Boldon. I don't know if current law would allow this. I mean, I know House File 1016 just deals with while the patient is located in Minnesota. So this bill does not go the other way with this reciprocity, and staff could certainly correct me on that if I'm not giving you the correct information.
Yeah, thank you, Representative Marquart. And I don't think we right now have the ability, we're Minnesota, we can't tell North Dakota, we can't write the bill to make North Dakota do anything. But anyway, I'm going to ask Ms. Sunderman to actually give the official answer to the question. Ms. Sunderman.
Madam Chair, members, that's right. So under Section 148.211 Subdivision 2A, which is the subdivision that this bill amends, you'll see paragraph D, which requires the board to seek reciprocity with the other border states. And I believe there is a license reciprocity process with all, if not most, of those states. But this bill would not change the current law in other states regarding license recognition.
Okay, Representative Boldon, any follow-up?
No, just thank you again for bringing this important bill forward. And I just want to be sure that I understand the scope of this bill. So thank you very much.
All right. Thank you, Representative Boldon. So I know that Representative Quam has some amendments, and I don't know if that's why your hand is up, Representative Quam, but why don't we go to questions first before we go take up amendments, if that's okay? Did you have a question?
Madam Chair, yes, I had a question in relevance to this. My understanding is that in past years we had reciprocity with our neighboring states, but as our neighboring states joined the Nurses Compact, the Compact constricted their flexibility for agreements outside of compact states. And I was hoping that staff would be able to clarify that interaction so that we could understand more than just, North Dakota. I believe it all the states are affected by that constraint, which is within the compact.
Ms. Sunderman, can you address that?
Madam Chair, members, I am not sure on that. I can look into it and get back to the committee. If anyone I don't see anyone from the Board of Nursing on here, but they would also be able to answer this question thoroughly.
Okay, thank you. Representative Munson.
Yeah, thank you, Madam Chair. And I was going to comment on much of the same stuff that Representative Quam did. I'm a large supporter of the Nurses Compact legislation, and that would provide full reciprocity with, I believe, 35 states now. And for a state that has that where we're a destination medical center like the Mayo Clinic, I think that's really important work to be able to allow telehealth calls across state lines. It's very, very, I think it's very important, but I think he did answer the questions on how other states have changed their reciprocity based on the Nurses Compact. So I'm supportive of this bill. It helps, moves us in the right direction. Thank you.
All right, thank you. Other questions? All right, not seeing any. And then we do have 2 amendments. And Representative Quam, did you want to move your amendment, one of your amendments? I should say move one and then the other, I suppose.
Yes, Madam Chair, I would move the A1 amendment, which would be the broader Nurses Compact and participating in that, so that our nurses would be able to practice in basically 2/3 of the United States, and would open up, because of telehealth, telemedicine, the follow-up calls that are so often involving the nurse staff with patients, whether it's tourists or whether it's one of the 1 or 2 million that visit Mayo Clinic. Once they return to their home residence or home state, it makes it more difficult for Minnesota to provide the care. And so this would allow for us to join the vast majority of the United States in this arrangement, and allowing broader functionality for our nurses. And I would like a roll call.
Okay, there will be a roll call. So Representative Marquart, as the author, any comment?
Thank you very much, Madam Chair. And, this House File 1016 is very narrow in scope. And I don't know a lot about the Nurses Compact, but it sounds like it involves many states. It would greatly expand the bill. I guess I would not know what those implications would be on this. So I would respectfully ask members to vote against Representative Quam's amendment.
All right, thank you, Representative Marquart. So I would just say before the vote that, this is a very big, complex policy. It's been quite controversial over the years. I think that if we were going to really consider this policy, we'd probably have at least 20 testifiers here to testify on both sides of the issue, because there's a lot to be considered. And so to just put it on as an amendment, I don't think it's really appropriate at this time. And so I would just ask members to vote no on the amendment. So the clerk will take the roll on the amendment, and the chair votes no.
Liebling, nay. Vice Chair Hewitt. Vice Chair Hewitt. Lead Schumacher.
Schumacher, aye.
Schumacher, aye. Representative Eklund.
Eklund, aye.
Eklund, aye. Representative Backer. Excused. Representative Bonner.
No.
Bonner, no. Representative Bierman.
No.
Bierman, no. Representative Boldon.
No.
Boldon, no. Representative Damath.
Damath, aye.
Damath, aye. Representative Freiberg.
No.
Freiberg, no. Representative Grunhagen.
Grunhagen, aye.
Grunhagen, aye. Representative Keel.
Keel, aye.
Keel, aye. Representative Morrison.
Morrison, no.
Morrison, no. Representative Munson.
Munson, aye.
Munson, aye. Representative Pryor.
Pryor, no.
Pryor, no. Representative Quam.
Aye.
Quam, aye. Representative Ryer.
Pryor, no.
Ryer, no. Representative Schultz.
No.
Schultz, no. Representative Wolgamott.
Wolgamott, no.
Wolgamott, no. Madam Chair, there are 7 ayes.
And Representative Hewitt is here as well. I don't know if we got his vote.
Oh, Hewitt.
Hewitt's no.
Hewitt is no. So there are 7 ayes and 10 nays.
All right, there being 7 ayes and 10 nays, the motion does not prevail and the amendment is not adopted. To your other amendment, Representative Quam?
Thank you, Madam Chair. And I wasn't surprised at that, but I felt it was appropriate to discuss it because of the general topic of the bill. I would like to move my A2 amendment.
All right, Representative Quam moves the A2 amendment to your amendment.
This amendment is basically to be proactive so that if we have a emergency and one of the hospital facilities ends up having to quarantine or loses a large portion of their staff, they would be able to quickly bring in nurses so the patients had continuity of service, and it would be temporarily accepting the nurse licensure from compact states, and it most generally would probably be the neighboring states of where many of our hospital systems have facilities, so that they would already be, I guess, shifting employees from one facility to another. And the idea is we've had a year, we've seen some of the situations, and in statute, I think this is a prudent approach for an emergency measure so that we have it in statute as opposed to having the governor do it by executive order.
All right, discussion to the amendment. Representative Pryor.
Thank you, Madam Chair. I reviewed the amendment and I also reviewed the existing executive order, which does permit licensed professionals from other states to come into Minnesota during the pandemic. And right now, the executive order, I think, functions much better than this amendment would. So I will be voting no. I think that what we have right now is better than the amendment would give us for public health.
All right, thank you, Representative Pryor. Representative Marquart, anything you'd like to say since it's your bill?
Yeah, thank you, Madam Chair and members. I would also ask members to vote no. I think this greatly expands the scope of the bill. And again, just not knowing what implications this might have. So thank you, Madam Chair.
All right, and I thank you. And I agree with Representative Pryor. And so I also would ask members to vote no. And so
Madam
all
Chair,
in favor of
Madam Chair.
Representative Quam?
Thank you. In response, sometime the executive order is going to go away. And this is meant to be ready proactively ahead of time. And frankly, since this is being laid over, I think it would be prudent that we incorporate something like this in the larger general bill so that we can take what we've learned in this past year and enter options in statute that will better prepare us for the future. Thank you, Madam Chair. And I would like a roll call.
All right, Representative Quam requests a roll call. And Representative Quam, I would just say that as I'm reading the amendment, it actually only lasts during the peacetime emergency. So I don't think that the amendment as drafted actually does what you are hoping it does. So clerk will take the roll and the chair votes no.
Liebling, no. Vice Chair Hewitt.
Hewitt, no.
Hewitt, no. Lead Schumacher.
Schumacher, aye.
Schumacher, aye. Representative Ackland. Representative Ackland.
Eklund, I.
Eklund, I. Representative Backer, excused. Representative Bonner.
No.
Bonner, no. Representative Bierman.
No.
Bierman, no. Representative Boldon.
No.
Boldon, no. Representative Damath.
Aye.
Damath, aye. Representative Freiberg.
No.
Freiberg, no. Representative Grunhagen.
Aye.
Grunhagen, aye. Representative Keel. Representative Keel. Representative Morrison.
Keel, I.
Keel,
Sorry
aye.
about that.
Representative Morrison.
Morrison, no.
Morrison, no. Representative Munson.
Munson, aye.
Munson, aye. Representative Pryor.
Pryor, no.
Pryor, no. Representative Quam.
Aye.
Quam, aye. Representative Ryer.
Pryor, no.
Ryer, no. Representative Schultz.
No.
Schultz, no. Representative Wolgamott.
Wolgamott, no.
Wolgamott, no. There are 7 ayes and 11 nays.
All right, there being 7 ayes and 11 nays, the motion does not prevail. The amendment is not adopted. Final word on your bill, Representative Marquart.
Thank you, Madam Chair and members. Again, thank you for hearing the bill. Thank you for your accommodations today. And this is just a bill that I think would help with convenience and quality of care for Minnesota residents. So appreciate your consideration.
All right, thank you, Representative Marquart. So with that, House File 1016 is laid over for possible inclusion in the finance bill. So thank you, members. We, even with a little recess, thank you, Representative Marquart. We have zipped through our agenda for the day. I really, thought we were going to be here at least till 4:30. So you get an hour of your beautiful afternoon back, and we will see you all on Monday. And we're going to be posting that agenda very shortly here. So thank you so much for your giving us a big chunk of your Friday, and have a great weekend, everybody. We are adjourned.